Okay, thank you. Well, I'm actually an associate professor in oncology, and I'm leading the Cancer and Environment Department at the Regional Cancer Center here. I'm also the head of the Access, Nutrition, Environment and Epidemiology of the Canceropole Clara, which is the over-regional cancer research network organization who actually contributed to the organization of this session and the prevention here. And the work I'm leading in our department, we're working mainly on breast cancer in the research, and with two programs. One is on obesity and physical activity, and then there's more on the environmental risk factors in breast cancer. Regarding obesity and physical activity, actually, I don't know if you're familiar with this, was Chris Wild, who is the director of IARC, the International Agency of Research in Cancer, formulated the approach of two ways translational research, translating knowledge into clinical practice and only into prevention. Actually, what our program is about is translating into clinical practice knowledge which is already tried to be implemented in prevention, which is on obesity and physical activity, which are both known and established risk factor for several cancer. And Catherine Hill showed these are smaller cycles, of course, than alcohol and tobacco, but still are estimated to be responsible for obesity for between 4 and 40% of some cancers, and physical activity around 10%, for example, for breast and colon cancer. So it's also a considerable contribution to the cancer burden, in particular as the level of obesity and the lack of physical activity is steadily increasing in the general population. It's estimated in France that about 15% of the general population is obese today, and this has doubled in the past 30 years, and that around 30 to 40% of the population are only conforming with the WHO recommendations of 30 minutes. So these people are in the same situation when they come to be diagnosed with cancer. What has been observed in our research and also by others, that at the time of the cancer diagnosis, their level of physical activity is much decreasing at the time of diagnosis. Also, cancer is normally associated with weight loss and cachexia, but there's also much risk of obesity for several cancers, in particular breast cancer, associated with weight gain 6 to 12 months after. So these guidelines for the general population are also applicable to the cancer population, and it has been shown that first physical activity and obesity are contributing to or lack of physical activity and obesity are contributing to much side effects, but also to some increase in mortality and cancer recurrence in breast cancer and colon cancer patients. So we try to implement this guideline in cancer patients, and actually what we get aware, and I think this is something which also comes to the presentation of Catherine Hill, that well, the study shows a significant benefit in those patients of practicing physical activity and maintaining normal weight after cancer diagnosis. However, these are clinical trials, and you see cancer patients around 60, 65 years. But I've recently reviewed the literature on physical activity in breast cancer patients, and the mean age in all these trials was about 52 years. So the evidence comes from patients that are much younger than actually your target population, and the level of physical activity in those trials, it's amazing. about the results, but it's not the level of physical activity you will expect from the general cancer patient. So in terms of research, there's actually two major research directions we're working on how to implement these physical activity guidelines into the population of cancer patients who do not correspond to the population which has actually participated into the trials. How can this be translated? So this refers to the implementation research. And the second aspect is, which is not much known today, which are the factors and signaling pathways involved into the contribution of physical activities into reduction of recurrence of breast cancer and also other cancers.
So on some level, you're relying on an oncologist to maybe espouse this message. I mean, how receptive is the oncology community to the idea that, well, you might tell your patient to exercise or incorporate this into their lifestyle? Is that?
There is some change in position of the oncologist, because in the past it has been, if you're diagnosed with a cancer, you should quiet and not too much tiring yourself, not to get too much fatigue. And actually there becomes conscious that actually you should stay active, and that physical activity contributes to combating the cancer and treatment-related fatigue. Actually, it's two more anecdotic but probably relevant to other setting. First, we have done a randomized trial, and it's very difficult to do double-blinded randomized trial in physical activity, as you can imagine. So the physicians, they were saying to the women, well, actually you should participate in this trial because physical activity is important. And actually this trial compared a physical activity program versus normal recommendation diet and physical activity recommendation. Actually we're very disappointed because we didn't show any difference, but what we showed that both arms increased considerably their level of physical activity. And actually we tried with some social science researchers to investigate what happens. But first, well, we also had this problem that the women in this trial, they were much younger than the median age. The second was that probably the women who entered the trial were more interested in physical activity than those who didn't. Mm-hmm. And those who were in the non-intervention arm, they said, well, actually, the doctor said physical activity is very important. You should go into the trial. And then we were in the non-intervention arm, where we said, well, we should do physical activity. So this was the incentive. Mm. And actually, when we started the program in the cancer center, only 5% of the patients come on recommendation by the physician. The others came by the nurses and by advertising in the cancer center. And last year, there was about more than 50% of the patients in the program, they come because the physician said, well, you should practice and go into the physical activity program. So it's a change in perception by the physicians, and the patient expressed that actually it's very important that the doctor talks to them about doing physical activity.